Hey everyone, and welcome. For those that are new to the podcast, hello. For those that are returning, thank you so much for all your support. So, for today's podcast, I wanted to briefly go over some pelvic health and lymphatic health consideration coming from a journey of through fertility to postpartum. So it seems like a big undertaking. This may take a couple parts to this podcast, as I really value having short, quick, snippet to a podcast where you have about 15, 20 minutes on your hands when you're doing your walk and everything, and you're driving home from work or picking up the kids or whatever the case may be, instead of just lecturing, right? Now, this podcast is going to be published in the month of May, which is a lot about Mother's Day. And I just want to stress that we are very exclusive here at North Star Physical Therapy. And so some podcasts tend to be leaning towards those that were born with more female oriented genitalia and tissues with vagina, ovaries, uterus, those kinds of tissues. And some will be a little bit more towards the kind of male oriented genitalia with penis, testicles, scrotum, and a leg. So this podcast goes a little bit more towards the more identified as more like female tissues. For those that are listening to this closer to Mother's Day, no matter if you were assigned female at birth or not, if you're a motherly figure, you know what? You are also happy Mother's Day. Celebrate to you too. Okay. So you don't have to be mom, you can be aunt, you can be sister, you can be mother-in-law, you can be grandma, or just being that maternal figure in someone's life is so important. So happy Mother's Day for all of those out there. But here we're going to be talking about when pelvic health and lymphatic health, what their importance is when someone is within their fertility journey. So yes, a pelvic floor physical therapist does not say, yep, we can make sure our goal is for you to conceive. That's not our role within the medical, but it is our role to help prepare those tissues and help prepare that environment, to help prepare your body for those that wish to get pregnant, prepare that body for that pregnancy. It goes through a lot. And so I see a lot of clients that are preparing for pregnancy, and maybe they have some outstanding pelvic health symptoms like urinary incontinence, fecal leakage, or constipation, or even more orthopedic, like low back pain, hip pain, things like that. Or they are also trying to conceive, and just the act of having sex and intercourse is painful. Or they also maybe have endometriosis on board, and we're working through pain management and flexibility of those tissues as well. So pelvic health considerations just within that fertility journey is so very important. And there is a wave of pelvic floor physical therapists that are specialized and certified in working with those within the fertility lifespan, which is beautiful. And I think for those that are really seeking a fertility journey and walking hand in hand with their pelvic floor physical therapist is so very important. We want to make sure these tissues are flexible and strong. We want to make sure that orthopedically you're nice and sound and also flexible and strong. We want to have any kind of, if there are any soft tissue restrictions, not just on the pelvic floor, but then also within the abdominal area itself. So if you've had a prior surgery, there might be scar tissue, which I tell all my clients, scar tissue can be good for the scar to heal. However, we want to make sure that scar tissue is not adhering or sticking to any other layers so that scar tissue can move while you move. That scar tissue can stretch a little bit as your abdominal cavity is going to be stretching to hopefully have a fetus and baby. So we also factor that in as well. And if someone has prior symptoms before even getting pregnant, we really want to tackle that first in the fertility journey. Pelvic health is very important whether you're pregnant or not, or you're wishing to get pregnant. So within that fertility journey, please make sure a pelvic floor physical therapist is a part of your community. All right. We also want a little nugget there for the partner who wants who is walking with the journey for those that are getting pregnant. For example, just by pure example, if it is a heterosexual couple and the female would get pregnant, the male also may need to be maybe talked or educated or potentially seen if an issue is pain with penetration. Could it also be want to look out for that partner as well? So is it painful for them too? Or are they having a difficult time getting into the right position for that penetration, for that fertility journey to start? Do you see what I'm saying? So we also are looking at the full picture there within pelvic health too. So if that is something that you're dealing with, you absolutely want to be having a good communication with your partner, but also good communication with pelvic floor therapist. And if your pelvic floor therapist also sees that individual, for example, for this example was for males. So some pelvic floor physical therapists do not treat men, and that is okay. That's in their purview. And you want to make sure that the pelvic floor physical therapist can also capture any difficulties or issues with your partner. I do, friends, I often see maybe the partner as well to just capture all of that. And that way we can also help educate the partner that if the one that's getting pregnant does get pregnant throughout this fertility journey, that here's some consideration the partner needs to think of as the pregnancy continues, right? And how they can help and be supportive. So it's all fantastic to do all of these kind of prehab kind of things, all those preventative things, and to really step into that potential pregnancy with a lot of education, a lot of knowledge and awareness, and therefore also, again, having that pelvic floor physical therapist alongside you to help modify or progress things within your wellness program and within your exercises, and to be continuously assessing those tissues and make sure we're preventing any potential like sciatica development, round ligament pain, back pain, like things like you often hear that couples with pregnancy, but that's not necessarily normal, right? So that kind of helps capture a really quick snippet of the pelvic health considerations within the fertility journey to get pregnant. For those that are within a same-sex couple, and even if someone has a surrogate, it's also just to kind of get this education, to get that awareness of what's going on with your surrogate too. And so if there's any kind of supportive thing there you can help with, that's often really nice as well. For those couples that are needing to get a little bit of assistance through IUI or IVF, fantastic. Again, we just want to help prepare the womb, the uterus, the vaginal tissues, the vulvar tissues, orthopedically, hips, rib movement, the spine, getting some good support for the soft tissue for the breast that are going to be increasing, as well as the belly, as well as maybe getting some good footwear for the support from your feet, all those things. So I just listed out a few things that we include within. I have a pregnancy program here. So going from the fertility journey into the pregnancy program, there are a lot of orthopedic nerve involvements that we looked at. We're looking at any kind of prior pelvic floor conditions or symptoms that you may have to really help maximize and help optimize this pregnancy journey. So within a lymphatic system, we want to make sure we're also decongesting that system throughout the fertility journey as well as throughout pregnancy. When there is a fluid overload, which will happen with pregnancy because you are now having a whole other being that you're growing and you're supporting, and that their blood flow and their lymphatic system and their tissues are developing. So there's the whole amniotic sac. There's all of their fluid, right? So there's a lot of fluid being introduced into the person who's pregnant's body. And there is a common symptom of swelling in the leg with pregnancy. And it can also be swelling like in the arms as well, really anywhere else. And so I often teach a certain technique of lymphatic drainage for those that are seeking to get pregnant, so within their fertility journey, as well as those that are pregnant and even postpartum as well. So we want to make sure that the lymphatic system is really flowing really well. We're not developing any kind of secondary lymphedema during the pregnancy. If I have somebody who is already showing signs of that swelling, then what is really the appropriate compression garment for that person? Some people, it is a knee high. Some people, we do need to get up to a thigh high or a legging with a maternal panel. Some people have it more in their like arms, and we maybe get like a sleeve or with a glove or something like that. So we often are recommending certain kind of compression garments to really help out, again, supporting the tissues, supporting the skin, supporting the lymphatic system. So that way there isn't just entire like stagnant fluid. Things are being flushed, things are being going through the flow and the journey. So there isn't like additional symptom there within pregnancy. If I'm seeing somebody before they're pregnant and we're thinking that there may be a potential other thing going on, I often work with my medical colleagues, especially with vein specialists, to rule out any vein insufficiency. So we often hear varicose veins happening and hemorrhoids happening within pregnancy. So if I can have somebody even beforehand get that stuff checked out, so that when throughout pregnancy, we can always be like monitoring it. If I see somebody when they're already pregnant and we're already seeing these signs, we may often still recommend getting another medical professional involved as we're treating conservatively, because there can be things like a secondary lymphedema. There can be venous insufficiency that may develop, again, an insufficient flow from the legs back up to the heart. Not a blood clot, just a slowing of flow because of the increase of fluid that's happening and the amount of energy you're expending during pregnancy. But then we can also potentially develop what pelvic congestion or pelvic venous insufficiency. And so if I know somebody who may be having that before they're pregnant, we definitely want to make sure we're getting that medically managed with them and conservatively, so that during their pregnancy, their venous system is already working really well. And so we're less likely to develop any additional swelling or pelvic pain during that time. So there you go for kind of the fertility to pregnancy journey of the pelvic floor considerations and lymphatic considerations we think of. When we're moving throughout pregnancy, I alluded to a lot of that. When there's an increase in fluid, there's orthopedic changes, your spine changes, your ribs change, your pelvic area changes for sure. And so we have to consider these orthopedic changes. We have to consider the increase of fluid and what that does to your lymphatic system. We have to consider that like the baby is like jumping around like a little trampoline on your bladder. And so it's also pushing your ribs out, it's pushing organs like out of the way. And so your breathing capacity, your urgency, more common things that you hear within pregnancy of one peeing so much more constipation or having difficulty with that. Yeah, and the shortness of breath, even just like with a short walk. And so things like that we can absolutely address if there's any low back pain, any hip pain, any around ligament discomfort that's happening. Again, supporting you throughout your pregnancy journey, as well as preparing you for labor. So being able to capture all of these things, and again, I'm a pregnancy program, so list down, these are all of the things we have to check out and consider and check the boxes so that by 37 weeks, we already have had all this taken care of. You have mastered all of these skills, and especially like functional mobility. Going from sit to stand when you're in your first trimester, not a big deal. When you're in your last trimester, yeah, you're doing like a roundabout, you're doing a lot of compensations because of all these tissue changes. And so we want to help reduce any compensations that's happening. We want to keep you nice and strong too. So being able to lift and carry things throughout your pregnancy, because guess what? Once on the other side of labor, you're going to have to be carrying baby. You're going to carry all their stuff, their diaper bag and the stroller. You're getting the car seat in and out. So all of those things, we really do practice that throughout pregnancy. So now when you're day 4 back from birth, whether it be a hospital or a home birth or wherever you choose, and you're now carrying this baby to a postpartum checkup, and like they're crying, you've got them in one arm, you're trying to like fumble around with the stroller. It's no, do that stuff before. Figure that stuff out. That's why you get that stuff with baby showers and whatnot. Get the stuff, open the box, and do not wait. But we're going through that, and what are the body mechanics that we need to consider? So that's a lot of included within pelvic health. It isn't just your pelvis. We're looking at the whole person and how it's moving and preparing those tissues, getting them in and out of labor position, preparing the perineal tissue, because that is stretched up to 400 times during the vaginal birth. And then regardless if you go vaginally or if you're C-section, we're going to prepare you how to get on a bed right after that C-section, how to appropriately position yourself and what your breathing pattern is going to be now the baby's out of the way, but your ribs are still clear. And how can we have a good bowel movement without causing like an exacerbation of your hemorrhoids? all of these and more kind of considerations within pelvic health. With lymphatic health, we want to keep maybe those compression garments on during that first or that fourth trimester, those first few months after, to help it get reset. The body's just resetting its new norm now. And because for those that choose to breastfeed, we absolutely that there's still an increase in fluid. You still need to be drinking for two. And so we want to make sure that is still flowing very nicely, not causing any stagnant fluid anywhere in the system. So postpartum meetings are really extensive as well. And I have a whole postpartum clinical program. And again, we have a little checklist of getting back into it. And I love seeing people within the first 2 to 3 weeks after birth. And keep in mind, when I just said that, 37 weeks, we've gotten everything all figured out. And the last few weeks we're just reviewing things. And whenever baby decides to come, baby decides to come. But then I'm doing a virtual checkup with my folks 2 to 3 weeks after they've given birth. And I've decided to do this because I don't really necessarily wait to see people until that 6-week mark. We can capture a lot of these things and reduce the amount of compensation, answer any of these questions virtually so that way it's comfortable for everybody, that we're getting used to a new norm. You're just surprised you put on clothes and you took a shower, right? So just happen on a quick little virtual session is really helpful to help answering these questions, nip things in the wet. People are thinking, oh, is this normal? There's a medical professional like myself that can help guide. Yes, that is something to really talk about your doctor ASAP, or that can probably wait a little bit. Or great question, go ahead and reach out to them. Or, what I noticed when you went to go sit to stand, you're still doing the roundabout where you don't need to do it anymore. Practice that breath technique. There's a lot of things we can go over one more time in that virtual follow-up. Then I check in with my folks in person about that 6-week mark. And so there is where we're checking externally again, we're reassessing everything on the outside of the pelvis, right? How is the low back pain if there was before? How is the hip pain? What labor position were you in with delivery if it was vaginal? Was it a C-section? Is there any tearing, things like that? So then we also check the external pelvic tissues. And just to make sure things are feeling really nicely, it's in line with the timeline of tissue feeling. You have to remember this tissue takes about 6 months to a year, and genetics are a big component of this, to really heal. It took you 9-10 months to get pregnant and have a child. It's going to take you that, or maybe a little bit more, to get back into it. So it is completely wrong, quite frankly, to have a 6-month checkup with your OB/GYN. Some OBs actually check mom. A lot of people just go through questions, but some of them actually physically check mom, which is nice, but they're looking at the organ. They're looking at the vaginal tissues, looking at the uterus, they're looking at the organ. They're not necessarily looking at the pelvic floor muscles, and they're definitely not looking at you as a big picture. And we're not precluding that. There's just not their specialty. And that's okay. That's where your pelvic floor physical therapist wants to meet you with that journey on the other side of labor to get you back to where you want to be, or what is your new normal now? When are you, for those that return back to the office, right? When is that going to be happening? Because that's going to be a different external stressors. Is there another child that you're also taking care of? Is this your first pregnancy or your 10th pregnancy? They're all very different. And the postpartum care is different every time as well. So a pelvic floor physical therapist is absolutely essential for those that are going through their fertility journey, that are pregnant, and that postpartum. So from fertility to postpartum, you absolutely need to have a physical therapist that specializes in pelvic health by your side, along with your OB/GYN, midwife, doula, and that medical team as well. Okay. With lymphatic health, you absolutely need to have those considerations as well. So even postpartum, when we're having potential a clogged milk duct, there are certain massage and lymphatic techniques that we can do for the breast tissue itself. There are pelvic lymph nodes. You're still feeling that heaviness or that pelvic discomfort, and the pelvic floor physical therapist maybe looked over those tissues and couldn't really figure out why. Could be those pelvic lymph nodes might be congested. And there are some pelvic lymphatic drainage techniques. So to have a pelvic floor physical therapist and a lymphedema therapist in your back pocket throughout fertility, pregnancy, and postpartum is absolutely essential, just like the OBGYN, midwife, and doulas. Okay. And lactation consultants too. And the fact that you can find, like for me, I am both. And so I definitely combine my two worlds and I do both for all of my clients. And so it is really nice to have that comprehensive care throughout fertility, pregnancy, and postpartum timeframe. So please, if anything else that you learn with this podcast is if this is you or a family member or a friend that's going through this journey of fertility, pregnancy, and postpartum, please absolutely ask them, or if it's you, I'm sure there's a pelvic floor physical therapist and a lymphedema therapist in your back pocket throughout this journey, and to be able to use them as a standard of medical practice, just like your OBGYN, because having that team together is so beneficial for you going through that journey, going through all those changes, and recovering on the other side with optimizing your pelvic and lymphatic health. All right, guys, thank you so much for listening to this. And in the next episode, just a little sneak peek, is going to be about a little further on the journey. Again, we're to get a little bit more female oriented with this next discussion. And so I'm really excited to continue this as we present all this in the month of May. And so it's very female focused and forward. But again, happy Mother's Day to all of those moms out there and maternal figures, because you're needed, you're wanted, you're absolutely loved. And thank you so much for everything that you do. All right, until next time.